Well, thank you for stopping by and seeking to find out more about mental health, the treatment gap, the grand challenge. I'm Professor Paul Farron. The treatment gap is basically the difference between the number of people who are identified as experiencing a mental health problem and the number of people who are experiencing or receiving treatment. About 50% of people who are identified as experiencing mental health problems aren't receiving an evidence-based treatment. On a global scale, in less developed, lower resource countries, this is astonishingly up to 90%. So we're offering 4 inquiry groups to be able to try to understand and maybe through the outputs, try to offer solutions to close the treatment gap further. One of the inquiry groups is seeking to understand some of the personal level barriers, some of the reasons why people themselves choose not to seek treatment. You could focus on the student population. We've seen a massive increase in the availability and the use of computerized psychological therapy, in particular computerized cognitive behaviour therapy. Whilst we know it works, one of the barriers is that services themselves are choosing not to offer it. So potentially one of the outputs is trying to understand why services may be reluctant, and then to think of a potential pitch to try and get them to start considering offering this way of providing psychological therapies. The final 2 inquiry groups are really innovative and looking at different ways to improve well-being. One of these is using novels which are focused around a particular life challenge that people may be going through. Final inquiry group is looking at the benefits that may arise to well-being from physical activity and exercise. And you'll be interacting with experts from the National Health Service, from the Improving Access to Psychological Therapy programme, and experts from services or voluntary groups who have an interest in mental health, or indeed experts who have lived experience of mental health. So if any of this sounds of interest, we'd love to see you. We'd love to interact and engage with you in discussions. So sign up for the Mental Health Treatment Gap Grand Challenge.